Thank you. I now recognize the Congresswoman from West Virginia, Ms. Miller.
Thank you, Chairman, and thank you, Ranking Member. And thank you all for being here today, because it helps to have people testify on the real impacts from the policies that come out of Washington, D.C. About a month ago, this committee met in my home state of West Virginia, and we heard about the tangible impacts of the failed Democrat policies, many of which have contributed to record high inflation, and what effect they're having on the folks outside of the Beltway. One of the most compelling testimonies that I heard was from a lady named Ashley Bachman, who owns a restaurant in Petersburg, West Virginia. And she testified that she was unable to offer health care to her employees because of how expensive it was. And as a matter of fact, her whole family is uninsured because she can't afford the monthly health care bill on top of all the costs associated with her business. And I was really kind of sorry to hear that story. Ms. Moore, first of all, I want to thank you for showing the respect that you have for your employees and how important they are to your business. So many times people in this bubble they seem to think employers are the bad guys, and you're not, and you do really appreciate your employees. You shared the difficulties of being a small business owner in the Appalachian region. Ohio's part of the Appalachian region. You talked about your experience having to cut health insurance benefits for your employees. Can you just talk a bit about making that decision and how hard it was as a business owner?
I will share, and I will try not to tear up, because these are individuals. We know their children. We know their extended families. Not because I grew up in those communities that I have business in, only because we have a relationship as an employer-employee relationship that extends far beyond a paycheck. When I had to look an adult man in the face and tell him, I can't help you anymore, find insurance for your family, for your 2 growing sons, and I know that your wife is not eligible at her employer for insurance, so I'm going to leave the whole family of 4 out to defend for themselves. I can't do a single thing for you. I couldn't even, because of the mandates, supplement and give him extra money to help find. I mean, my hands were totally tied.
I hate to stop you. No. Because we only have so much time, and I'm really happy that you are now able to reinstate their health coverage. You know, your employees thankfully have health coverage, but most people in rural America still do not. So now I need to ask Mr. Niswander a couple questions. You know, being a healthcare provider for such a rural community certainly gives you a unique insight into the struggles of rural America and what we face when trying to receive health care. Have you seen patients who are unwilling to get treatment for their medical services because they're worried about the high costs?
I have actually. Just last week, I had a patient that came in that I haven't seen for a long time, who's a very brittle diabetic, who needs several bottles of this $30 insulin every month that she can't afford. And she delayed care for many months, even from calling me, to the point that her foot developed a necrotic wound that put her in the hospital with a high deductible plan on the ACA coverage. She came to my office with a wound vac attached to her foot and talks of amputating that foot now. It was the fear of that high deductible plan that kept her from getting care.
It's just so difficult for patients to physically travel where they need to, let alone receive the care, and it's a shame that the cost of care is just another barrier. It seems another issue I feel is an obstacle to quality health care in rural America is the difficulty retaining a robust rural health workforce. And I think you all agree to that. Can you talk just a bit about finding healthcare providers to come and join your practice?
It's difficult in rural America. The insurance reimbursement rates, like Dr. Winstrip and Murphy are aware, are fixed. We have no bargaining power whatsoever. Expenses are going up. The pandemic's over, but the price increases are not. That translates into many medical practices closing down. because of the strain that it puts on the ones that are left. He talked about mental health resources. Over 70% of psychiatrists do not accept insurance because the reimbursement rates are so terrible. Our patients are suffering because rural America's hospitals and medical providers are shutting down left and right.
You're exactly right. Mr. Chairman, I yield back my time.